Asthma is the single most important cause of respiratory disease morbidity and causes 1,500 deaths per year in the UK. The prevalence currently 10 to 15% is increasing in Western society. The incidence of wheeze is highest in childhood, and you'll be amazed that 1 in 3 children wheeze and 1 in 7 school children have a diagnosis of asthma. Asthma is being classified into three major categories: extrinsic, intrinsic, and occupational. Let us look them in detail. Extrinsic asthma. This is classical asthma with onset in childhood. That's why it is also called as childhood asthma, which is commonly associated with the previous history of atopy. What is atopy? Atopic is defined as the genetic tendency to develop the allergic diseases or the conditions. So, in this case, it is actually associated with the familial diathesis manifest as childhood eczema and the hay fever. It is the most common asthma and seen in 60% of the cases. It's also predisposed to form Ig antibodies and it has a strong relation to the family history. This type of asthma remits in the teenage years, but it can come later or recur during the adult life. Intrinsic asthma. This subtype tends to be of adult onset. It is more progressive and less responsive to therapy, and it is less likely to be atopy related. What is the underlying abnormality seen in intrinsic asthma? Abnormal autonomic regulation of airways. The distribution is about 40%, and the family history is absent in intrinsic asthma, unlike extrinsic asthma. The predisposition to form Ig antibodies is absent, and it is also associated with COPD, chronic obstructive pulmonary disease known as chronic bronchitis. The drug hypersensitivity is present in intrinsic asthma, whereas in extrinsic asthma, it was absent. Occupational asthma. It relates to industrial or workplace allergens. Example: baking, soldering, welding, paint spraying, and animal handlers. In occupational asthma, you can see two responses. Either it is associated allergically or non-allergically. So in allergic, it is immunological mediated with a latent period between exposure and the symptoms. Whereas in the non-allergic situations, there is an immediate response after the exposure, like the inhalation of certain toxic gases